Top 5 danger signs. Your kidneys are crying for help. Must know. Kidney disease often grows silently. Many people don't realize something is wrong until the damage becomes serious. If you live with high blood pressure, diabetes, or if someone in your family has had kidney failure, your risk can be much higher than you think. Right now, about 35.5 million adults in the United States are living with kidney disease. The scary part is that most of them don't even know it. Doctors can confirm kidney disease through medical tests, but your body often sends warning signals long before that. The problem is, many people ignore these signs or mistake them for normal aging or everyday fatigue. In today's video, we're going to break down 5 dangerous warning signs that your kidneys may be crying for help. These are signs you should never ignore because catching them early could protect your kidney function and even save your life. Make sure you stay until the end of this video because I'll also share a simple but powerful tip that can help you protect your kidneys starting today. Something most people completely overlook. Number 1. Feeling very tired or having trouble concentrating. One of the earliest warning signs that your kidneys may be in trouble is feeling tired all the time, even when you think you got enough rest. Many people ignore this sign because they believe it is just stress, aging, or a busy lifestyle. But in some cases, it can be your kidneys quietly asking for help. Healthy kidneys remove waste and extra fluid from your blood. They also help balance important minerals and support red blood cell production. When kidney function drops, waste and toxins begin to build up in the bloodstream. This can make your whole body feel slow, heavy, and weak. According to the National Kidney Foundation, when toxins stay in the blood, people may feel tired, have low energy, and find it harder to stay focused. You may notice that simple daily tasks feel more difficult than before. Some people also describe a feeling called brain fog, where thinking clearly, remembering things, or making decisions becomes harder than usual. Kidney problems can also affect sleep quality. When toxins build up, they can disturb the body's natural sleep cycle. Some people with kidney disease have trouble falling asleep or staying asleep, which makes fatigue even worse during the day. Another common reason for low energy is anemia, which often happens in people with kidney disease. The kidneys normally release a hormone called erythropoid, clears throat, which helps the body produce red blood cells. These cells carry oxygen throughout the body. When the kidneys are damaged, they may not produce enough of this hormone. As a result, the body makes fewer red blood cells and oxygen delivery to muscles and organs becomes lower. The American Kidney Fund explains that anemia linked to kidney disease can cause fatigue, weakness, dizziness, pale skin, and shortness of breath. Many people feel exhausted even after small physical activity like walking upstairs, carrying groceries, or doing simple housework. What makes this warning sign dangerous is that it usually develops slowly. People often adjust to feeling tired and may think it is normal. But if you constantly feel drained, lose motivation, struggle to focus, or feel weak without a clear reason, it may be an early signal from your kidneys. Paying attention to these changes and talking to your doctor early can help detect kidney problems sooner, when treatment and lifestyle changes can still slow down kidney damage and protect your long-term health. Number 2, trouble sleeping. Another warning sign that your kidneys may be struggling is having trouble sleeping. Many people think sleep problems only come from stress, anxiety, or using phones too much at night. But in some cases, poor sleep can be connected to kidney health. Healthy kidneys filter waste and extra fluid from the blood and remove them through urine. When the kidneys stop working properly, toxins begin to stay in the bloodstream. These toxins can affect how the brain and nervous system work, making it harder for the body to relax and fall asleep. According to the National Kidney Foundation, people with chronic kidney disease often report poor sleep quality, frequent waking during the night, and feeling restless while trying to sleep. Some people may also experience itching, muscle cramps, or uncomfortable leg sensations at night, which can make sleeping even more difficult. Sleep problems are also strongly connected to sleep apnea, a condition where breathing repeatedly stops and starts during sleep. The American Kidney Fund explains that sleep apnea is more common in people with kidney disease compared to the general population. When breathing stops during sleep, oxygen levels drop. This puts extra stress on the heart and blood vessels, which can worsen kidney damage over time. Obesity also plays an important role. Being overweight increases the risk of both sleep apnea and chronic kidney disease. Extra body weight can place pressure on breathing during sleep and also raise blood pressure and blood sugar levels. These are two major causes of kidney damage. Another issue is frequent urination at night, also known as no-cura. When kidneys cannot properly balance fluid levels, people may wake up multiple times to urinate. This interrupts deep sleep and prevents the body from fully resting and repairing itself. The Centers for Disease Control and Prevention, CDC, notes that ongoing sleep problems can increase the risk of high blood pressure, diabetes, and heart disease, all of which can further harm kidney function. If you often struggle to fall asleep, wake up many times during the night, snore loudly, or feel tired even after sleeping, it may be worth discussing kidney health with your doctor. Improving sleep quality and checking kidney function early can help protect both your kidneys and your overall health. Number 3, dry and itchy skin. Many people treat dry or itchy skin as a simple skincare issue. They change soap, buy moisturizer, or drink more water. While those steps can help normal skin dryness, long-lasting itching that does not go away can sometimes signal a deeper health problem, including kidney disease. When kidney function becomes weaker, the body slowly loses its ability to keep important minerals in balance. Over time, phosphorus levels in the blood can rise while calcium levels may fall. According to the National Kidney Foundation, this mineral imbalance is closely linked to a condition called chronic kidney disease mineral and bone disorder, which can affect both bone strength and skin health. When phosphorus builds up in the bloodstream, it can trigger intense itching under the skin. Many patients describe the feeling as constant irritation that scratching cannot fully relieve. In some cases, the itching becomes worse at night, making it harder to relax or sleep comfortably. Another reason skin problems appear is the buildup of waste products in the blood. The American Academy of Dermatology explains that when kidneys cannot remove toxins properly, these waste materials can irritate tiny nerve endings in the skin. This can lead to persistent itching, rough skin texture, and dryness that feels different from normal seasonal dryness. Some people may also notice their skin becoming flaky, tight, or more sensitive than usual. Scratching too often can damage the skin barrier, increasing the risk of infections or slow healing wounds. This is especially concerning because people with kidney disease may already have weaker immune responses. Kidney-related mineral imbalance can also affect the body's natural moisture control. Reduced sweat gland activity is common in advanced kidney disease. Sweat normally helps maintain skin hydration, so when sweating decreases, the skin can become dry and more vulnerable to irritation. The American Kidney Fund notes that these skin changes often appear alongside other symptoms such as fatigue, swelling, or changes in urination patterns. Because skin is one of the most visible organs in the body, it can sometimes provide early clues that internal systems are under stress. If your skin feels constantly itchy, dry, or irritated without a clear reason, and regular skincare products do not help, it may be worth discussing kidney testing with a healthcare provider. Recognizing these external warning signs early can help protect kidney function and overall health before the damage becomes severe. Before we continue, if you're finding this video helpful, please take a quick moment to subscribe to the channel. It really helps us create more videos that can support your health and well-being. If you have any questions, concerns, or personal experiences about kidney health, feel free to leave them in the comments. I always enjoy reading and learning from your stories. And just out of curiosity, let me know where you're watching from and how old you are. It helps us make better videos that match our audience. Now let's continue with the next warning sign you should never ignore. Number 4, urinating more frequently. Have you ever noticed that you need to use the bathroom much more often than before, especially during the night? Many people think this is just a normal part of getting older, but frequent urination can sometimes be an early signal that something is wrong with kidney function. Your kidneys control how much fluid leaves the body through urine. They filter blood and decide how much water and waste should be removed. When the tiny filters inside the kidneys, called nephrons, become damaged, they may lose the ability to properly control fluid balance. This can lead to a stronger and more frequent urge to urinate. According to the National Kidney Foundation, Increased urination, especially waking up several times at night to urinate, can be an early warning sign of kidney damage. This condition is known as nocura. It not only interrupts sleep, but can also leave people feeling tired and drained during the day. In the early stages of kidney disease, damaged filters may allow more fluid to pass into the urine. As the condition progresses, the kidneys may also lose their ability to concentrate urine. This means urine may appear lighter in color or more diluted than usual. Frequent urination can sometimes be linked to other urinary problems as well. For example, urinary tract infections can irritate the bladder and cause a sudden increase in urination. In men, an enlarged prostate can press against the urinary tract and create similar symptoms. The American Urological Association notes that prostate enlargement becomes more common with age and can cause weak urine flow, frequent bathroom trips, and difficulty fully emptying the bladder. Another important factor is blood sugar control. The Centers for Disease Control and Prevention, CDC, explains that people with diabetes often urinate more because high blood sugar pulls extra fluid into the urine. Over time, uncontrolled diabetes can severely damage kidney function. Pay attention if you notice sudden changes in how often you urinate, especially if it comes with foamy urine, blood in urine, swelling, or unusual fatigue. These combined symptoms may suggest kidney stress rather than simple bladder irritation. If you regularly wake up multiple times during the night to urinate or notice long-term changes in your bathroom habits, it may be wise to discuss kidney testing with your doctor. Detecting kidney problems early can greatly improve treatment success and help protect your long-term health. Number 5. Foamy urine. Many people rarely pay attention to how their urine looks. Most of the time, they simply flush and move on. However, urine appearance can sometimes give important clues about kidney health. One warning sign that should never be ignored is urine that looks unusually foamy or bubbly. It is normal to occasionally see small bubbles in the toilet, especially if the urine stream is strong or if cleaning products are present in the water. But if you regularly notice thick foam that stays in the toilet and does not disappear easily, it may be a sign that protein is leaking into your urine. According to the National Kidney Foundation, protein in the urine, also called proteinuria, is one of the earliest signs of kidney damage. Healthy kidneys normally keep important proteins inside the bloodstream because the body needs them to build muscle, repair tissues, and support the immune system. When the kidney filters become damaged, protein can pass into the urine instead of staying in the blood. The most common protein found in urine is albumin. Interestingly, albumin is also found in foods like eggs, which explains why foamy urine can sometimes look similar to the foam seen when eggs are beaten or cooked. The American Kidney Fund notes that persistent protein leakage is often linked to chronic kidney disease and may gradually worsen if left untreated. Protein loss from the body can also lead to other symptoms. Some people may experience swelling in the feet, ankles, hands, or face because protein helps control fluid balance in the bloodstream. When protein levels drop, fluid can leak into surrounding tissues and cause visible swelling. Foamy urine can also be linked to conditions like diabetes and high blood pressure. The Centers for Disease Control and Prevention, CDC, explains that both conditions are leading causes of kidney disease because they can slowly damage the tiny filtering units inside the kidneys over time. It is important to understand that foamy urine does not always mean kidney disease. Dehydration, certain medications, or temporary infections can sometimes cause similar changes. However, if you frequently notice thick, lasting foam in your urine, especially along with swelling, fatigue, or changes in urination patterns, it may be a good idea to speak with a healthcare provider and request a simple urine test. Paying attention to small changes like this can help detect kidney problems early. Early diagnosis gives doctors more options to slow down kidney damage and protect your long-term health. Kidney disease often develops quietly, and many people do not notice the warning signs until serious damage has already happened. That's why recognizing these 5 danger signs, constant fatigue, trouble sleeping, dry and itchy skin, frequent urination, and foamy urine can make a huge difference. These signals are your body's way of asking for attention before kidney problems become harder to treat. Taking care of your kidneys does not always require complicated treatments. Simple steps like regular checkups, managing blood pressure and blood sugar, staying hydrated, and paying attention to small changes in your body can help protect your kidney health for many years. If you found this video helpful, please take a moment to like, subscribe, and turn on notifications so you don't miss future health tips that could protect you and your family. Also, share this video with someone you care about. You never know who might need to see these warning signs today. And remember, listening to your body early could help save your kidneys and your life.